endurance, cardiovascular responses,
Yep.
power,
Mhm.
hypertrophy.
Yep. All those. And the cool thing is like if you reverse engineer the process and you say like this is what the person needs to be capable of doing, you can kind of delineate like what are the physical adaptations that we need to achieve in order for them to do that really well. So like if you're working with a soccer player, like just say like a high school soccer player versus maybe like a 100-meter sprinter for track and field, your adaptations and your training methodology should be very different for those two people, at least like towards the end range, like end phases of rehab and conditioning. Early phases, they'll look very similar because what do they need? They need range of motion, they need control, they need some basic motor competence and basic like general physical outputs. But as you get into like more of a regimented training cycle, now it's how do I appeal to this person who has to run 100 meters as fast as they can versus a field sport athlete who might be running up to 5 or 6 miles a game and making hundreds of cuts while they do so. Like the way that we approach those two athletes is very different. And I think that's what makes me excited about training is you kind of have to figure out like how can you mold your process to work with a person in front of you. It's not just giving them a cookie cutter and saying like, oh, this program will make you super strong. It's like, okay, it might, but is that going to make you a better soccer player? Is that going to get you back to where you need to be? And in many cases, the answer is no, unless you kind of look at the whole picture. All right. So kind of let's do this like kind of full circle. How long does it take to achieve neurological adaptations? Like our CNS level changes, our motor coordination, rate coding, stuff like that. Generally speaking, how long do those types of adaptations take? Meaning in like days, weeks, months?
Couple of weeks typically, right? Right, like at the most. Like you were even mentioning, like people kind of getting the program down, like as they're running or returning to run for the first time. Like sometimes that can be an in session change, or sometimes it'll take up to a couple of weeks.
Yeah, like from a basic competency standpoint, you can get changes within a few minutes. Now the question becomes like, well, how long does that last for? Is this like the higher the level, the more elite you become, the longer it takes to get those adaptations, right? If we're talking about an Olympic level sprinter, they've been doing that for decades to get to the level they're at. But if we're talking about basic competency with jogging, when you've jogged before, that's going to take a couple sessions, maybe a couple weeks, assuming they have all their prerequisites. But what about things like hypertrophy? Does that take 2, 4, 6, 8, 10 weeks to like truly see some like tissue level changes? Kayla, what do you think?
Like months even,
Yeah,
depending on the skill level and the history of training.
yeah. Like the example I always think of is like ACL patients, like even at a year and beyond, even if you're crushing their quad multiple times a week, in many cases, they're not going to be perfectly symmetrical at the end of a year. And that's with like ideally like 9 to 12 months of regimented strength training. They still may have like a tissue level or a hypertrophy level difference, even if you're crushing it consistently session to session. Obviously, like their strength levels should be much more equated at that point, but like their actual tissue girth might not be the same. So like that can be anywhere from you probably won't start seeing changes till like about four actual weeks, but then beyond that, it's going to kind of compile on top of that, right? And then like one more before, so I don't belabor this point. Like I like what you said about like endurance and like cardiovascular, like health and efficiency. One of the things that fascinates me about that is there's actually a lot of debate in terms of like what actually drives things like lower resting heart rate. Because with certain athletes, you can have a significant drop in resting heart rate with like a few days of training. So does that mean that they have like more mitochondria or like angiogenesis has taken over? Like, no. Early on, it's literally just like the brain and the body becomes more efficient and more smooth at shuttling blood through the body, right? So it's more of like an efficiency thing versus a horsepower thing. But as you do weeks and months of like aerobic type training or energy system development, then you actually have tissue level changes like peripheral tissue that starts to change. So you get more mitochondria, you have more blood perfusion via more blood vessels, and you have the ability to kind of shuttle more blood in and out of muscle and tissue because of the efficiency of that system. So it's kind of cool because most adaptations have very quick, like short-term changes. And if you continue to push them, it creates more of these long-term, like cascade of actual physical changes. Because when you think about the human body, it's reluctant to change. Think about how much effort it takes to add a pound of muscle to your body. Like the amount of physical effort and the amount of actual like energy consumption that it takes to add tissue is a lot. But how hard is it to lose a pound of muscle? Like if you're bedridden, you can lose muscle significant muscle very quickly. So it's kind of like one of those use it or lose it principles where it's really hard to gain that stuff, but unfortunately it's really easy to lose it. So again, like going back to think of our early like post-ops or people that are like very deconditioned, if we don't give them some kind of like potent stimulus, they're going to lose all of their hard work, or at least they're going to be harder to get that stuff back if we don't dose it throughout rehab when it's appropriate, right? I go on tangent. So any questions before I before I get too far off?
I have a question. So,
Yeah.
let's say you're working with a weightlifter, power lifter, someone who's kind of has a regimen and programming. They
Mhm.
come into you with some kind of pain. Are you looking, is the first thing you're doing, looking at their programming, looking at their form and working on some modifiable factors before you're even jumping into Therex? Because sometimes you can just adjust those.
Mhm.
And then are you still adding Therex and trying to fix that problem? Or are you just modifying and saying, hey, you're good, just either widen your grip or toe out a little bit more and look, no pain, let's not worry about it? Or are you, I mean, I guess it depends on their goals, but what are you looking at with that?
I think there's a million ways to approach it. I think the simplest one is to start by looking at like, so I would ask them first, I'm like, well, when did this start happening? Right? Like if they say they do their weightlifting or they do CrossFit, it's like, okay, if this happened after they boosted their volume really quickly, the very first thing I'm going to do is just look at their programming and say like, hey, this makes sense. Like you were doing this much, and then you increased it by like 50% in a short period of time, and then X, Y, and Z started hurting. That makes a lot of sense. So in that circumstance, I would just adjust their program and I would explain to them like, this is a natural response to you overreaching. Like you gave your body too much of a stimulus and it wasn't ready for it yet. It's not to say you can't do that in the future, but we need to kind of take a small step back and then build back up to that a little bit more intelligently. And then I think you'll be totally fine. This is very different than if somebody has an acute injury or some sort of injury that there is like actually a mechanism or like a sudden moment where like, ooh, I felt my shoulder, I felt my neck. I'm going to approach that very differently than like a overuse injury or an underprepared injury. So if that's the case, then I'm going to be, yes, I'm going to be doing load management. I'm going to say, I still want you to train like, hey, lower body, you can still crush. Let's take out like overhead pressing movements and heavy horizontal pressing, but let's add some like Therex in terms of maybe let's do some landmine presses. Maybe let's do some ISO holds. Let's do some like bear position type stuff. So I will always ask myself, like, if there's an actual mechanism of injury and it's like an acute, like tissue level trauma or joint level trauma, you need to make some kind of modification. And I think we have plenty of tools to do that. It's almost easier if it's just load management. Like I'm sure all of you have had somebody who's like a runner or a swimmer or a cyclist who comes in and literally all they did was they boosted their volume too quick and they just feel like shit. And you nicely explain to them like, hey, this makes a lot of sense. Here are some possible reasons why that happened, and here's how we can go about fixing that. But the nice thing is like, usually that's more of like your tendinopathy or like your bone stress type injuries. Those are easier to manage in a lot of ways because it's just intelligent programming and giving them kind of like a segmented way, like linear periodization. Like how do we slowly increase this over time versus having somebody who, even something like a muscle strain, that can be a little bit more hit or miss because everyone's healing rate is going to be a different level. And their level of activity, like if they're a CrossFitter or a weightlifter, if they've got like let's take like a hamstring strain. If they've got a hamstring strain as a CrossFitter, it's very hard to modify their regular workouts because everything involves jumping, lifting, like something explosive. So now you have to be a little bit more nuanced in terms of like what is okay to do or how do I modify these movements to make it okay for your current presentation. So like a quick example would be like if it's a hamstring strain with a CrossFitter, I'm going to say like, okay, I don't want you doing any sort of box jumping. I don't want you doing like heavy Olympic lifts or anything like that. But things we can do, you can still squat with slow tempo. You can work on some like slow eccentric work. We can work on some RDLs within like tolerable pain. And I'm going to give you some really hard ISO holds and eccentric work. So that way they still feel like they're working really hard. But what you've done is you've kind of constrained them a little bit more. So they're doing things that are a little bit more intelligent for their current presentation. Does that make sense?
Yeah, absolutely. Thank you.
Yeah, of course.
Just to piggyback off that and add on it, I think like what you're saying about like making them feel like they're working out is really important too, especially in like that population. Because it could be a huge like mental health thing too with that person that like, yeah, would it probably be better if you just shut them down completely for maybe a few days if it's a hamstring strain? Like, yes, probably. But also like what's that going to do to them like mentally or like just like for their community aspect of things. So I think still having them say, hey, yeah, it's fine for you to still go to the gym. It's just you probably want to pull back on this, and this. So just a good point to that.
No, I love that. Like I always ask myself, even if I don't say this to the person, I'm like, how can this person still generate intensity without putting themselves at increased risk of something bad happening? So like in the case of this hamstring injury, it's like, guess what? You can crush arms, you can crush shoulders. We can do all sorts of other variations where I just take your hamstring out of the equation and we can still be successful with that. And I feel pretty confident, right? And then they still know like, all right, like I'm not broken. It's no different than if you're working with like a field sport athlete who gets pulled away from their team because they can't participate. You still tell them like, hey, go to practices, hang out with your team, like do whatever you can to still be part of the team, even though you can't play right now. And I agree. I think that's often overlooked, but like from the psychological standpoint, that's very profound. Yeah. Any other thoughts or questions? Could be about anything. I don't want to pigeonhole you guys. What are some things that like you might have in the past or presently like struggle with from like a session planning standpoint, or like say you see somebody like 2 or 3 times a week, do you have trouble deciding how to break up those days?
I think for me, one thing that I've been juggling with a lot lately is finding the balance between like changing things on a session to session basis and then figuring out like what needs to stay the same. Because I think we talked about it a lot when I was up there with you, and like I'd usually go based on a template of like these are the foundational patterns that I want to accomplish, like a hinge, a lunge, like a lateral chain type of movement, things like that. But I'm coming around a little bit more. Like I feel like initially, like I would have my flow sheet and I get to the 10th visit, and one of my colleagues said it looked like a Sudoku puzzle because literally every block was just like new stuff. And like I think I was doing a pretty good job of like still accomplishing like the same end task, but now I'm coming around a little bit more and I'm like, okay, I'm going to keep these certain things the exact same, and then these are like the other variables I'm going to modify. So I don't know, I'm just curious like if anybody else kind of struggles with that, and then also like kind of how you navigate that, or like some of the things that go through your brain on like a session to session basis on like when, I don't know, I'm kind of just like spitballing because that's like the main thing that I'm struggling with right now and I'm trying to navigate, because I think a lot of the times like I'm in more of a setting now where people just don't do anything. And so like sometimes just giving them anything is good enough. And like, when is it acceptable to just like, hey, here's your routine, like run through it. And if you have any questions, I'm here, versus like, hey, let's spend like 30 minutes like going through new stuff.
Mm-hmm. Yeah. Well, let me open that to the group first. Who has thoughts on that?